All right. Remember how we talked about the introduction section of your poster needing a background and problem statement or paragraph? Here we are. A research problem is a statement about an area of concern, a condition to be improved, a difficulty to be eliminated, or a troubling question that exists in scholarly literature, in theory, or in practice that points to the need for meaningful understanding and deliberate investigation. A research problem is a specific issue or gap in existing knowledge that you aim to address in your research. You may choose to look for practical problems aimed at contributing to change or theoretical problems aimed at expanding knowledge. This means you need to establish that there is a need for further investigation. You will be spending quite a bit of time finding articles that help support the need for further investigation. Important to note is that you are not answering the clinical question here. You're not pre-stating what you will find to answer your clinical question. For example, if your clinical question asks something about distraction techniques to minimize pain in children getting a vaccination, you won't be talking about that intervention of distraction techniques in the introduction per se. You will be establishing that children receiving a vaccination are fearful. Let's say that vaccines are painful, that it is difficult to convince children to receive a shot, that the nurse needs methods to make the whole situation easier on the child, and so on. This is not anecdotal information, but evidence that you find in articles. State statistics here, and cite the articles that support that there is an established underlying issue. Perhaps you find some articles that state that 95% of children express fear of injections, and one that states that nurses often express hesitancy in giving children shots because of their wiggling. And maybe a few others that state parents are expressing hesitancy in following through with timeliness in vaccinating their children due to the perceived trauma, and so on. You are establishing that there is a need to investigate further as to if distraction techniques have shown to be helpful or not. Clinical nursing problems selected for inquiry are generally those encountered in nursing practice and those that deal with modalities of patient care such as support, comfort, prevention of trauma, promotion of recovery, health screening, appraisal and/or assessment, health education, and coordination of healthcare. The psychosocial dimensions of healthcare are an essential aspect of clinical nursing research. In establishing the research problem, consider the following guidelines. Number 1, you want to contextualize the problem. What do we already know? Number 2, you want to describe the exact issue your research will address. What do we still need to know? 3, show the relevancy of the problem. Why do we need to know more about this? 4, set the objectives of the research. Evidence-based practice problems can be defined as having problem-focused or knowledge-focused triggers. For problem-focused triggers, these include quality, risk, adverse events, or other issues identified by staff during the normal course of their work. Example, problem-focused triggers include an uptick in the number of catheter-associated infections on a nursing unit, a mislabeling of patient's blood sample, or a patient fall. Knowledge-focused triggers. These triggers are related to new evidence in the medical and nursing literature. Example of knowledge-focused triggers include new guidelines for the care of patients with sepsis, studies on factors related to nursing job satisfaction for millennials, or a new standard published by an accrediting body that the organization reports to. Many people assume that they know the solution to their identified problem. But for evidence-based practice, it is important to realize that there may be more than one solution to a problem. Therefore, taking the time to rework your question so that it doesn't contain a solution within it is important. For example, in the question, does adding more nurses per shift reduce nursing burnout? It might be better stated, what are ways to reduce nursing burnout? Because it does not presuppose a solution to the practice problem you have identified.